In public health, WHO, UNICEF are very much encouraging for breastfeeding all over the world. However, sometimes we don't give enough emphasis on the mother and infant interaction. I myself have seen some cases came in at the age of 1.5 years with no speech, no eye contact. Of course, if you study from Dr. Dongkamon and others, then you say, oh, no eye contact, no speech. My goodness, this should be in the autistic spectrum disorder. However, when I play with the child for about 30 minutes, the child starts to call me Pa. Pa in Thai means auntie. He started the first word, that is Pa. So I wonder, what happened? The mother said she came out from her work to be a full-time housewife and give the boy breastfeeding all the time. So I asked her, did the child look into your eyes? Did the child imitate what you say, or smile, or do anything to interact with you? It took her a long time, and she could not answer me. And I said, oh, what happened? Now it came the helper. This is the aunt of the mother, told me that she might not have the time to really take any notice on the boy, because when she put the boy to her breast, she also get her smartphone and then work on the phone, texting. So she knows that the boy is sucking her milk, the breast milk, but she did not pay any attention or to interact with the child. So, it means that the baby is not receiving adequate social and verbal interaction. So then I have to start telling her, what you can do about it. Because when she came, she was very frightened that her child has been diagnosed as autistic. So this is why I would like to take this opportunity to inform all of us that perhaps 1 + 1 may not be 2.
We also told the mother that if she has to get away from the baby during the first year, where facial interaction with the mother as well as the father is most important. When they go away, when they come back, of course they have to pass through the stressful daily life. First, don't go to the child directly. Go to a toilet, clean your face, and come up with your happy face. Remember those 3 phases? Come up with the happy face. So the child will also always meet a happy face, not the sad face, not the stressful face. Of course, once in a while, of course, you will miss that. That's okay. They have to live in real world. So in the real world, they have to meet some, but not every day a sad face, a stressful face, because that will make the child imprinting and imitate the face and become the child background or platform of life throughout their life. Our personality is not only built, not born, is built by all these interactions. Okay, and of course, then neuroscience or basic research came after to explain. One of our colleagues who was born in Thailand, he's an Indian who was born near Indian Temple, Sirom Road, but he and also studied primary education and secondary school in Thailand, but he moved to study at Cambridge. His last name is Ramachandran. He's now at UC California in San Diego. Ramachandran is the author of this paper, Broken Mirror. You know, Ramachandran not only studied autism, but he studied also synesthesia, the abnormal sensory system of people, you know, called synesthesia. I don't have time to go in. But Ramachandran had the hypothesis that the reason one become autism or autistic spectrum with regarded to understanding other people's intention, able to develop language appropriately, is because you're able to perceive and reflect both other intention and your own self-reflection. He developed this mirror neuron system. In fact, mirror neuron system was discovered by an Italian group of neurophysiologists, you know, who study how the monkey reach out for a peanut and put them in the mouth. The Italian professor were interested in the motor control system of reaching out and put. One day, while he was doing a research, his friend came into the experiment, and before the monkey got the chance to grab the peanut, his friend grabbed the peanut first, and the monkey was stunned that the peanut had gone. But the same group of nerve cells that become activate, or we call firing, you know, by the whole system of reaching out and work the same way, you know. And so instead of going out and kick his friend out of the lab, the professor who discovered it said, hey, come back, redo it again. And it worked again and again and again, and that led to the discovery of the so-called mirror neuron system. You know, mirror neuron system is the way you do it, monkey do it, or monkey see it. You know, and at the same time, the child do it or the child see it, and it's very important.
Remind the pathway, right? And
Ramachandran discovered that if he measure the electrophysiology, the EEG, the brain wave from the child, he could find a waveform called mu wave, which is a part of the alpha waves between 8 and 13 cycle. And this mu wave, if you see other people doing it, a movement, it will be very high. And when the child start doing it, this mu wave is suppressed. The difference between what you see and what you do. But in autism, it did not. It did not. And he published this in Scientific American and many journals. And so this is one of, and he presented this at many meetings. In normal children, the mu wave is suppressed when the child do it himself. But when he see other people do it, it did not. But in autism, they lack this mu suppression. So at least we are closer. This mu wave suppression, that is not only related to autism alone. That's the whole problem with autism. Autism is so heterogeneous and so common with so many things. We are now finding this related to a more complex thing that related to empathy. Empathy, you know, empathy. Empathy is ability to generate something beyond yourself, to be kind, understand, compassionate, and that's a little beyond autism, you know, but it is something in the right direction. Okay, I was going to say that in normal situation, the mother feeding, breastfeeding, the interaction during breastfeeding, and daily during the first year of life is very important to provide these nourishing, not only nutritional nourishing, but sensory nourishing, the interactive nourishing. However, when this fails, do we have anything to help? Of course, when Simon found that mother has low 60% of the mother who bear the child that develop autism, and also the child has also a poor receptor, which has been evidence-based. Could we push that by oxytocin? Of course, oxytocin could be worked peripherally and centrally. Oxytocin in peripheral causes smooth muscle to contract, and it contracts the uterus to give the childbirth. In clinics, if you are not doing cesarean section, the obstetrician will inject oxytocin in the IV fluid, and in 15 minutes, the uterus contract and the child come out. So he could almost date to the minute the childbirth, you know. Timing. Okay, but that's not the same as oxytocin in the brain. And in adult, if they're grown up more than 2-3 years, the pathway from the blood to the brain of oxytocin is closed. Oxytocin has to be produced by the brain. How could we get oxytocin into the brain? Nasal spray. So if you spray oxytocin in the nasal, another hormone that we do that is calcitonin. You know, we have calcitonin nasal spray, we have now oxytocin nasal spray. So before applying to human, they have to develop animal model because no ethical committee will allow you to do nasal spray without animal data. Yes, if you give Depakine to pregnant women, pregnant women, you have to watch whether the child was born with autism. If you give Depakine or another name of this is Tecatol, because we use them also for neuropathic pain and epilepsy. If you inject this medicine to pregnant rat, compare with normal rat. In normal rat, when the pup was born, they will play with each other. But when you give this drug, the pup will go to different corner, alone. Not only that, they emit the high speed, the high frequency sound, similar to the that the autistic children also had problem. Okay, so they give nasal spray of oxytocin to the rat, to these animal model of autism. 15 minutes, all these rats come to the center and start looking at each other, running around with each other. So with that evidence in mind, they start clinical trial with oxytocin. I'm glad to say that oxytocin now have passed phase 3, and in some countries phase 4 multi-center trial, and I think 4 countries now oxytocin for nasal spray could be an alternative treatment, not for everyone, for children who have some indication that they are not having enough oxytocin, because it improves their social behavior quickly, it speeds up their social interaction and language development, but they do nothing about their stereotype repetitive behavior. Nittaya, how you treat stereotype repetitive behavior, particularly those which are dangerous?
For those who are very aggressive or self-injurious, we need to do a lot of behavioral modification, but if it is very serious, then we have to add also some medicine to help controlling to lessen the amplitude of the emotional lability, because these kids sometimes they respond to the environment in a very extreme way, and many times they respond to their inner stimulation, which nobody will know what is it. When they are like that, they lose their self-control, and nothing can calm them down. So if we have that kind of situation very often, then we need some medication to help them, calming them down. But that is not the only way to treat them. You just use that as an instrument to help calming them down, but at the same time we have to do the behavioral modification, and we have to find out what is the thing that stimulates them. Sometimes it's the sound, sometimes it's the smell, sometimes it's some some situation, some strange situation. So we use different kinds of treatment at the same time. But for those who are very extremely severe, then we need the medication.
I like to stress that oxytocin is not a silver bullet that treats autism all. Again, it worked like a charm for some symptom in some autistic or autistic spectrum child, but it did not cure everything. We still have
that would facilitate interaction. So it's like supporting. You still need the mother to interact with the child, right? You're not just only use the oxytocin.
Right.
You still need others.
But you know how the pharma could push this to become a standard in the near future. I can see that the dossier for oxytocin is now with Thai FDA. Waiting
it become
for
a kind of a love medicine or something.
A love medicine in the future.
Love hormone.
A love hormone. Oxytocin also work for older people. If you give oxytocin nasal spray to older gentleman, he will look around for the mate. And if you give it to a lady, she also look around for her husband. So it may be some cosmetic thing. And I see on the internet, people start asking, where could I buy oxytocin? Okay, but okay, let me use the last point for two things. I have many things to say until tomorrow morning. Okay, I'd like to now embark on what causes autism or autistic spectrum disorder. As we have many experts in this room for many different fields, autism has been blamed for teratogen. You know, anything that caused abnormality in animal model, prenatal infection, also chromosomal abnormality, gene abnormality, but we could not find a single gene defect that would explain our. And 80 to this is some disparity. Some say 80, some say 90% of them is idiopathic. We could not find any reason. But and one of the things that came into this is the fact that we now find more and more mother who smoke, mother who drink during pregnancy, particularly smoking with nicotine, which cause constriction of the umbilical blood vessel and cause the brain to become hypoperfusion, and hypoxia. But it's not the cause for autism alone. It causes for all abnormal development. To the point that we have what we call fetal programming or epigenetic factor. Epigenetic for the brain is still a new field. And we now have kits, chemical kits, that we could look for the tagging of methyl group on the DNA and block the DNA. That we call epigenome region. The first group of doctors who use this are the oncologists, who find that the more of the region in the brain that has this epigenome region or alter DNA, it's not mutation, it's blocking of the expression of DNA, is related to prognosis of cancer. The more epigenome region, the poorer the prognosis. We start now working with epigenetic factor for the brain too. Okay. Okay, and that also related to many things. So far, genetic factor for autism are the most significant cause of autism spectrum disorder, and there are numerous, almost more than 300 candidate genes. Most of them involve protein that related to development and function of the nervous system. Okay, one of the mechanisms is that some gene has multiple copy, and by using a technique called some of our colleagues would say more about it from China. Are you here, Dr. Mar? Okay, okay. I saw in your abstract. The technique is called microarray, chromosomal microarray analysis, MCA. Okay, could study how many copy of gene you have, and copy number variation had been one of the area of research in the future. The other one is to do whole genome scan, and that's quite a lot of work and a lot of. So now they have now concentrate on just the portion of gene that code for protein called exome, okay? And so this is MCA, the chromosomal microarray, and you will learn more about it. I'm not the expert in that area. And sequence of the exome, okay, would be. But from that we learned a lot. One of the extensive reviews show that, number one, autistic spectrum disorder are extremely heterogeneous in every way. That's not 1, 2, 3, but hundreds of them. Second one, a lot of them are evolutionaries. Some severe one of them die in utero. Like Nittaya mentioned, Rett syndrome boy die in utero. Whereas if they are a girl, they were born and lived to about 10 years old. So there are some evolutionary things. But the most important thing is that there's no gene that identified to date that cause autistic spectrum disorder only and nothing else. Okay? And unlike Fragile X, unlike many other genetic disorder, that they have, so we have not one that have just for autism and things like that. And I put in one of the table from this reference for you. For example, the most research one is on chromosome 16. That the evidence is 4+, but it only frequency about 0.5% of the population. It causes deletion. But it's not only shared for autism, it shared for attention deficit hyperactivity disorder. It shared with schizophrenia, obesity, and so many other things. So we still puzzle all this, okay? So this is the mechanism. Some gene could be deleted, some gene could be duplicated, some gene could be inverse and cause their difficulty in reading the frame. So the geneticists and molecular geneticists still have to work out things in more detail. Okay, I'm very glad that I saw recently, last year, a report from Thailand. Our colleagues in Thailand now, from Mahidol University, from Ramatipadi, our medical school, they have started working with autism for more than 10 years, making a cohort, so that they could do. And then they work with the molecular group, and they were able to use chromosomal microarray in this cohort population. And they could support the idea that some of these cohorts. The important thing I'd like to show here that these genes that they found are not sometimes found in the father or in the mother, and they are developing new de novo. We use this term de novo, which means newly developed in the affected individual. So the gene is not inherited. Is not inherited from the parent, and the parent cannot be blamed for it. But if the child born with this gene, with this gene, and they grow up, and he grow up and married, and he could pass that gene again. So this is very important for genetic counseling. So at the moment, if we tell the parent, and the family that we need to do genetic or chromosomal study. Okay, about other causes. Okay, defigurated mother, was blamed for the Jewish mother, in the old day, but it has been refused. Mercury in vaccine, I think the court has, the American court has approved and settled, but the new vaccine, mumps, measles, rubella is not going to be contaminated by mercury anymore. Okay, environmental toxin, we are worried. In Thailand, we have 2 extensively used chemicals in both as fertilizer as well as for insecticide and herbicide, and we are worried about that. Immune deficiency is getting into it. But a very complex problem. But a new twist, and I see someone would talk about it, is the relationship between the gut and the brain. This is a new thing that I have not learned when I was young. I only learned about this a few years ago, that the gut and the brain has a good relationship based on some microbiology, and we call them gut microbiome, and I'm glad that someone can talk about it. And also, we learn also that some of our patients has allergy to food. Nittaya, can you say something more about this allergy to the food you have seen?
Some autistic spectrum disorder kids coming in with very choosy eater, being very choosy. They only eat one or two things, and they keep like that. They keep on, and they refuses all the others. Then sometimes we found that they had a history of food allergy. So we really need to consider what happened to the child who's very choosy eater.
Do they like casein and gluten food? No.
In my experience, I only have 2 kids with having this kind of a. They
but there are a lot of literature
gluten-free that really help, but most of the time they don't.
And I have to teach courses for our students in nutrition. They invite me to talk about neuroscience of nutrition, and I came across the work on ketogenic diet, including also the treatment of extracted coconut oil, the medium chain coconut oil, which are, I saw one of the sponsors, Sea Oil, have been involved with now autism. But I am still waiting for their double-blind placebo-control experiment. I urge them, if they want to become a standard in the treatment that the clinician could prescribe, they have to come up with that level of acceptable standard. But at the moment, a lot of people report anecdotal and good anecdotal, but we don't know the whole story yet. And it believed that the ketogenic, which mean that the boy eat more of protein and vegetable, and not so much on carbohydrate, not so much sugar, starch, rice, will do something with their metabolism and things like that. I put in the book these model of gene-environmental interaction, and you see it's complex, very complex. It starts from conception, mother factor, infection, toxin, and it provides trajectory during different time of birth, and also the trajectory of the brain development and the developmental outcome before the child could become autistic spectrum. You can find this in the reference we include. But the important thing is to give diagnosis for autism and autistic spectrum disorder. And for those of you who are interested, you can visit the website of Cambridge, University Cambridge Autistic Research Center, ARC, and you meet our old colleagues, Simon Baron Cohen, who received a prestigious award for his lifetime achievement. He is a clinical psychologist who has been working on autism more than 40 years. He's about our age, a little younger than us. He was the one who developed chat to ask whether we could diagnose autism earlier at 18 months. This work was done since 1992, and we now develop TDAS, which about the same. Okay, chat has been. Okay, I'm just going to quickly go through. Chat has provided the fact that these children lack the pretended play. They could not play as pretending. They have lack of proto-declarative pointing. Like you ask them, where is your puppy? The normal child will point to him. This one will not. and lack of social interest, and lack of social play, and lack of joint attention. Okay. Then later on, I think in 1996, Simon Baron-Cohen trying to call these psychological marker, you know, and in fact, the American Pediatric Academy modify his chat into what we call MChat, you know, MChat, and MChat together with many other things that Dr. Dongkamon already mentioned become our tool. But in order to work out the evaluation, we need a complete history of development, onset, medical, because autism could be related symptom, not the autism disease or real autism, could be developed because of many other medical and things. And we need to do screening tests, need complete physical examination, evaluation, and as I point out, we sometimes need to do genetic. And also, children with autism also have problem with sensory. Most of them could not stand very loud sound. If you take them to a big marketplace with a lot of loud sound, or take them to a concert, you know, where the sound intensity would put up very high, they would just go crazy, running out, you know. And whether we need to do brain imaging for all of them is a question mark. Okay, I think at this point, okay, in neurobiology we find many abnormality that Dr. Dongkamon mentioned could start to explain individual symptoms. But to put all of them together and use them as a biological marker still need a long way of work, and not one. For example, in this one, autism brain could be different from normal brain in many areas. Dr. Dongkamon mentioned amygdala. Just last month, a new finding came that in normal person, when they pass 3 years old, the amygdala will be larger, but in autism, they're not. And the function of those popular neurons is to be able to control emotion at older age. So when they don't have those, they could not control their emotion. The hippocampus also play a very important role in understanding some working memory and episodic memory. Cerebellum, that we know for some time, causing them to have problem with motor coordination. And corpus callosum, which connected to hemisphere, is also a thing. But what I like to show is that we have a new, and I summarize in the paper, area that related to social problem, communication problem, and some repetitive behavior, you know. But now we're trying to study brain circuitry. I was in the 3 Tesla MRI at the Phillips Development Center in Cleveland. That's me, and that's my brain, and that's my nerve fiber. This is a technique called fiber tracking, or DTI, which allows us to see individual. There have been reported that the pathway that process information are abnormal in autistic. We now could look at this in living using electrophysiology and some program. Okay, this show our the technique that by putting array of electrode on the head and record it with just simple laptop, one can look at how the brain process information. Can you see that? I did not imagine this when I was young, that I could see impulses of brain activity from one area of the brain going to another area of the brain in living alive, and superimpose on the anatomy, so one could look at connection between different brain area, okay, and go even deeper. These techniques allow us now to study in individual, what we call now brain connectome. I mean all the connection. This is a large data called connectome or connectomics. It allows us to look at different hubs of information and hubs that related. We now learned that in some hub, it becomes hyper-connected. The hub that become hyper-connected are usually located in a cortical area or in a small group of area. But when they have to send from this group hub to another one, they become hypo-connected. Hypo-connected, you know.
To me, it's like a lot of land, a lot of local area connection, right?
Yeah.
And the inadequate, the long distance connection, right?
How do we solve this problem? But the most interesting finding is that these are areas that related to what we now call executive brain. The executive brain or EF functional brain. And it had been evident that individuals with autism or autistic spectrum have problem in component called fluency, planning, and flexibility. What are executive function of the brain? During the last 20 years, this is a very hot area in neuroscience, because these areas are the area that control process necessary to guide behavior in a constant changing environment. That's why autistic people like to be in the same, doing the same, being in the same every day. They lack the ability to face the changing world.
Adjust to new things.
And they also a little bit lack of planning and working memory. Okay, here is the component of executive brain that can be now evaluated. You know, the newborn had inhibitory control that stopped them from going into things like if they claw on the table and see a visual clip that they will drop, they stop from going further. That almost become instinct. It inhibits them. But autism or child will not. They have working memory to understand what, hey, that was a lady who feed me and give me the first hug. That's my mom, you know. So and what she was doing. We were playing, and now she goes away. Why she came back with still face? You know, those are involved what we call working. And cognitive flexibility means as the environmental or situation change, they could adjust, govern emotion, planning, organization, make judgment, and start working. And this is about older, occur in older children, start learning problem solving, and almost everything, including moral reasoning. And it now becomes evidence-based that why severe autism fail. They fail school, they fail job. If you have severe autism, at the moment, the Thai government gives you the status of a disabled person. Okay, I think the time is right now that we could invite Dr. Dongkamon to come back and share with us some good thought. Okay. Nittaya, I'd like now to ask you first, in your experience, could you give us a summary of why it is necessary or how we could do early intervention?
Yes, I think after both sessions, we can see very clearly that if we can detect as early as possible, the chance of intervention with a good impact is there, considering the neuroplasticity of the early life. So the parents should be very much supported to find out if that what exactly the child has and how they can manage or they can give some support to the child so that we can lessen the influence of the problem and also increase the probability of the child to develop to the betterment of the child. And if you just leave it and say that, you know, wait and see, nothing should be done, then we may be too late, and it's very, very, very sad because you've taken away the opportunity of the child to develop sometimes to normal. And some very special cases, we can help them to reach even extraordinary being talented. I myself have seen some of the children who came to me at the age of 2 with no speech. And now they are very well educated and doing great job for the world. Some of them graduated in PhD from MIT, for example, and being a very talented.
That's the school for Asperger.
He was an Olympic champion in mathematics, for example. So I myself believe in the potentials in every child. The only problem is that how can we find them, and how are we going to support them together, not only from the healthcare side, but also from the educational side, and the most important is the family themselves.
Okay. Dr. Dokabot, could you make comment a little more about your recent experience of giving intervention? You have followed them for some years now. What are your experience for this early intervention?
Yes, thank you. From my experience, especially the first workplace is from Yuapasad Hospital in Samut Prakan province. That's the first hospital that I work that have some experience about the autistic children. And at that time, even the first diagnosis of the Thai doctor in this field still starts very, very delayed, like 5 to 6 years old. But in this decade, like 10 years, when I moved to the RICD, I'm working here for 15 years, and I saw many change about the diagnosis and awareness especially from communities, from families, and they refer to the hospital. The secondary or tertiary hospital is very early. Right now, it's about like 1 or 2 or 3 years old. And for example, very impressed me one case that they come to see me like 1.5 years old. This mom is a nurse that's working in Chiang Mai University, and she is very suspicious that her child have very like delayed speech and have strange words like we call jargon, but mom at that time she didn't know about this, and she keeps asking and see many doctors, visits many doctors, but some doctors just say just waiting, and maybe when he's 3 years old he can start talking because a boy will a bit delay for the speech. But she tried to find out the answer for her son, so she visited in the ICD at that time and met with me, and the first time I saw he have all of the signs that meet the criteria for autism, and I recommend her to try to get the early intensive attention at that time. Especially right now, it's about 10 years ago, and right now he is 15 years old, I think, about that. And I do the KABC, the IQ test, and right now his IQ is 130. He's very genius. And the first word he start is about 3 years old. 3 years old. But right now he studies in a special school for special scientist kids, the Jurapon School in Chiang Rai. That's for the very talented kid about the science. And he still have some problem that's about the adaptive in the new situation, or to stay in the dorm with the friends. So, but because of understanding of the families to try to help him, and everyone, even the teacher in the school, parents have to talk to the teacher every year in every new teacher, and try to keep talking and discussing to the doctor that give advice or counseling in each time of level of age development, like preschool age, school age, or when he be a teenager. Okay, this case very impressed me, that if we follow and see one kid that will diagnosis as autism, and his life and family will change for early advice and early detection from doctor. And when family understanding early, they will start. They did not shopping around, and this is the reason that our health professionals should help together to help kids with suspected autism or even the other delayed disabilities.
Can you please elaborate on why ASD is heterogeneous?
Okay, good. Very good question. To re-emphasize that. As Nittaya mentioned a little bit, and I show, heterogeneous means that they are different in many, many different ways. Even though we have 3 domains, like impairment of social interaction, impairment of communication or language difficulty, and restrict interest and repetitive. Each of these domains, there are so many items, and one individual doesn't have everything. They have a little bit of this, a little bit of that, a little bit of that. Now, also, what caused them? There are so many causal factors, and not every child has the same. Talking about the gene, which is perhaps to our best understanding, gene is very important because it dictates how the proteins are made. And the protein form the most important structural and regulatory of the function of cell, brain cell. Again, we find so many differences. So when we say heterogeneous in all the way, we mean from the causal, from the upstream level. In Thai we callต้นน้ำ or upstream, to midstream, to downstream, and that make autism or autistic spectrum disorder very challenging for the future medicine. And so that we need to apply what we call precision medicine for each individual. Another term we have for this is personalized medicine. Nittaya mentioned that not 2 autistic patients that she have made in her 30+ years of working clinically with these children are the same. They are somewhat different. But we have way to understand them, to know that they belong to this. But to work out in detail to the benefit of each of them, we have to pay attention to each of them, their detail. And that's why we use the word heterogeneous in many ways. I hope I explained this enough.
Yes, thank you.
Any more? How many people in this room have children with autistic spectrum disorder? Not me. We are lucky. Or maybe you did not want to. We have been in many places where people stand up, I have 2, I have 1, and I need help. and we could be very useful in that way.
Okay.
Okay.
Any more? Yes.
Yes, any more? please feel free. If you want to make any comment also. Okay. Otherwise, we would wait until we have our colleagues speak about anything. And I'm sure Dr. Kampon I saw his abstract, is going to give us many new directions. Okay, now it's 1 minute to 12:30. I give the floor back to Kampon.
Okay, thank you very much. And I would like to ask the audience to give them a big applause for what I call enlightening lectures. Well,